Good morning, good afternoon. We're just getting assembled. So give it about 30 seconds to get people together. Great, let's start this webinar. And welcome to our Innovator webinar, Improving Employee Satisfaction, Outcomes, and Costs, an executive discussion on corporate well-being. I'm Dr. David Nace, Chief Medical Officer here at Innovator, and really appreciate everybody joining on this busy Tuesday. So let's get started. I would like to introduce our guest speaker, Elizabeth Bierbauer, known as Beth Bierbauer. Beth is a 30-year experienced healthcare executive in healthcare. She just told me that she started when she was 4 years old. Is that right, Beth?
Pretty close.
Has had very senior roles at senior management roles at Humana, prior to that at Highmark, Coventry. Beth, thanks for coming, and I'm sure this is a topic that's near and dear to your heart.
For sure.
Awesome. So let's get started. I'm pleased to be here, and this is a very important topic as we start to think about the political climate and what that may mean for employers in the healthcare that they deliver. So Beth, let me start with a question for you. Healthcare is expensive. We know that as people that buy our own premiums, our own insurance through our health employer, but it's expensive for employers as well, isn't it?
It's extremely expensive. I think, as you know, it's such a large portion of what employers have to pay out and bake into, if you will, their product or their service. And it's just something that they seem to have never been able to really get their hands around, and costs just continue to grow, David.
You know, it's so interesting. We talk about a $3.5 trillion health spend in this country, and there's been a number of reports over the past 20 years from the Institute of Medicine, other places, showing that a lot of healthcare that is purchased is wasted spending. What is wasteful spending, and how do employers think about that?
You know, I think about wasteful spending from an employer perspective as duplicate testing, for example, right? Your primary care physician orders a test, and then she or he sends you on to a specialist, and then they want to order the test again. And sometimes you, as the patient, really don't even know, because you're sort of down that path and going with the flow, if you will, going along with it, and then you come to find out, well, geez, this is the second x-ray that you've had in 3 weeks, and it's identical x-ray. And it just all comes back to not being able to adequately share data, right? You have one brown clipboard to the primary care docs and one brown clipboard to the specialist. And so they're not talking to each other, so you don't know which tests you've had, whether they're lab tests or x-rays or other tests.
So as an employer, give me a sense of how much I'm thinking about my healthcare costs in terms of the benefit I offer my employees. Like, roughly, how big of a chunk of my total spend as a business is that in your mind, in your experience? And then also, how satisfied am I with what I'm getting as a bang for the buck for that? Those benefits.
Well, as an employer, I'm thinking about it all the time, 24/7. It is such a large portion of cost. Typically, when you think about healthcare costs, you would actually add a percentage on top of an FTE cost. So if your average FTE cost, let's say, were $75,000, $80,000, you might add, for all your benefits, you might add 35%, but 20 to 25% really would be tied just to medical spend. It's that significant. So as you can imagine, that for every FTE you have to basically say, well, really, you know, their salary isn't 100 grand, it's really 120 or 125 because of this healthcare spend. So it's a really big problem, and it's one that is so big that in every company that has a CFO or director of finance, it's number one on her or his agenda as well.
That's amazing. And do they feel that their employees are satisfied with the results of what they're being offered through their employer?
Well, that's the rub, David, is that they know that their employees aren't satisfied. satisfied. They know that there are low net promoter scores in this industry and that employees are frustrated and often have to try to, go through many iterations before they can actually figure out what's wrong with them. So it's this really high cost service with low customer service or a poor customer experience. So it's just at odds with anything else that we actually see out there in the B2B or the direct to consumer world. High price, bad experience. You wouldn't make that in any other industry. You wouldn't be able to survive.
That's just so frustrating. I've been working with employers off and on over the past 30 years as well. And, I've seen numbers like this bottom bullet here, where the cost of healthcare to the employer, to their business, is rising at a faster rate than inflation. And 6% next year, what's inflation, like close to zero right now?
Right, exactly. And it's just unsustainable, David. Companies cannot continue to pick up a tab that is increasing above inflation, especially as most companies, especially as a result of COVID, are looking for efficiencies. They're looking to figure out how to cut out costs, and they'd be able to say, oh my gosh, now I have to figure out how to set another 6% aside for healthcare costs. Again, they're struggling.
Yeah, so this is a great opportunity for us to get into this today, because really what you're describing is really a burning platform for employers. How do they manage their costs without sacrificing the quality of the care that's delivered and their objectives for offering these benefits? So we are talking about a lot of the American people, right, that are covered by self-insured employers.
For sure, and many employers have taken on some form of self-funding, David, whether it's full self-funding, if you will, they're totally self-funded, or partial self-funding is a means to say, how do I get more flexible with my benefit plan designs? How do I avoid premium taxes? They're really trying to look at every piece of the puzzle, if they will, so that they can figure out how to save some costs.
Yeah, it's amazing. And if you look at U.S. employer healthcare costs, we know that that cost is higher than we see in other countries in terms of their GDP. So it's just an enormous cost for employers in general, and yet they continue to offer these benefits. How do they think about the purpose for offering these benefits?
If you're a large employer, David, it's table stake. You're not going to attract any employee with any major capabilities if you're not offering health insurance. And as you know, that's why many smaller employers can't afford it, and they don't offer health insurance. And that's why some small businesses struggle to attract and retain employees. But this is a really big deal, because it is one of the first benefits questions that an employee will ask, or a potential employee will ask. They'll ask whether or not what the health benefits look like and what the 401k looks like. So it is right up there with really being considered a prized possession of the employee.
Yeah, I have to say, I understand that completely, having spent my 30 years in healthcare in this country. And as I near the magic age of Medicare, which apparently is going to go insolvent at the time that I am eligible for it, I certainly understand thinking about my employer offering a health benefit as an important piece of why I'm working where I'm working. So
very much.
Great perspective. It's just amazing why this cost is rising. And it's not just the cost for the employer. I understand that part of the way employers have dealt with this rapid rate of rise of healthcare costs compared to inflation is by pushing some of the money expenses to the employees themselves and their families. So tell us a little bit about your perspective of how well that's worked and how employers are thinking about that today.
That's right, David. Employers have been forced to increase deductibles, increase co-pays, increase co-insurance and out-of-pocket maximum as a means to try to keep premiums somewhat reasonable so they can continue to offer some type of coverage. The challenge with that is, I think that most Americans would struggle and have to figure out how to take out a loan, put it on a debit card or credit card, if you will, for $400 worth of debt or more. So employers are really trying to balance between how far can I take these deductibles up without, quite frankly, pushing my employees into medical debt. And it's a dilemma for sure.
Yeah, I think about seeing data, we don't have it here today, about the percentage of the net income of a family that's going to pay all of those co-payments, co-insurance, deductibles, etc. But it's quite significant, if I remember.
Right, I actually just looked at those numbers for another reason the other day, and now they're probably up to about 18 to 20% of your monthly household income for a family that isn't subsidized. So it's pretty significant because deductibles have risen so high that you'll see individual deductibles of $2,000, $3,000, $5,000. That's a lot of money, plus the premium.
Yeah, and we're now talking about COVID, and we'll get into that in a few minutes. But with COVID, the price of food has gone up, and then people aren't shopping as much; they're having it delivered, which is additional cost. So, geez, it's one of those kind of whack-a-mole or balloons, where you squeeze one place, it's got to come out somewhere else. So, tough place for employees.
Right.
So let's take a look at the current reality of this affordability issue. So. Here we do have some numbers. We look at the overall cost of an employer contribution to the premium and the employee contribution. Wow, these are big numbers, aren't they?
Yeah, they're really, really huge. I mean, you can see the employer contributions to the coverage is starting to approach $10,000 a year. I mean, that's just unbelievable. And you see the $1,500 deductibles. I'd say that, those are probably much larger than what I typically see, especially the smaller the employer gets, the higher the deductible gets, because they just really don't have the bandwidth to be able to support a lower deductible.
Yeah, I think one of the trends that's been talked about over the past decade or more has been this high deductible plan. I think those even play out differently.
Yeah, exactly, because with a high deductible health plan, you could have first dollar coverage just for preventive services. So it doesn't allow flexibility oftentimes for an employer to embed, for example, virtual care visits for free as part of the medical benefit. They can look to figure out how to do that separately, but not as part of the medical benefit. So it's been a struggle for employers. They're trying to get creative around this, but just as you can see on the slides, the numbers are they're astounding.
So how do we think about this? Employers are purchasing healthcare in order to have a healthier workplace, and as you say, table stakes, right? To attract people to work at their organization, to retain them at working at their organization. What is the impact of moving all these costs to employees and the higher cost for employees? How do you balance that as an employer? How do you think about it, and what's the bad impact of pushing the cost to the employer?
You call out a good point here. Employers really want employees to be healthy, right? So they have preventive care covered at 100%. And a lot of people use those services, but sometimes people don't use the services because they're worried that if they go to the doctor and the doctor finds something, well, now they're facing a $2,500 deductible, and they know that they can't afford that. So again, on the one hand, you've got the employer that's trying to do the right thing, saying, go get your preventive screenings. But on the other hand, you as the employer saying, I'm a little uncomfortable with that. What if something happens and then you have all this medical debt? I think there's something that is really important to know is that, especially with the result of the pandemic and all the financial struggles that people are in, healthcare will not be the priority for many employees. They're going to worry about shelter and food for their family first. And so what that means is that they're going to continue to hold back sometimes on some of this essential care, I think for the foreseeable future, for the next year or two. And that's really going to put the employer in a bit of a dilemma, because you do want your folks to access care. And if they do have something, you want them to get it taken care of before it escalates and they end up in the emergency room or the hospital. So it's really just a dilemma there.
Well, that's fascinating. We started here to talk about an affordability crisis, but if people are paying attention to other needs like food, shelter, etc., and in addition to that, we don't see the data here, but we've heard about it, that people have foregone elective surgeries and elective procedures because of the fear of going to the facility or the facility being unable to offer them currently because of COVID. My gosh, where do you see things evolving over the next year or two?
Well, I think anybody who's been facing a job loss or reduced hours is really going to be thinking twice about the health care that they receive, because they know they have to pay first dollar out of their out of their pocket. So I think besides elective surgeries, you are going to see people be a little bit more cautious. I think you'll see a pickup in telemedicine because people will say, hey, I heard I can actually go on and talk to a doctor for $40. I think you'll see some of these alternatives. People are going to start to get more sophisticated. I think you'll see increased use for some of these pharmacy services like GoRx and Blink Health, where people are saying, I'm going to find out the best pharmacy price for my medication, and that may or may not be with my health plan. So I think you'll see people becoming more savvy, but it's going to be purely out of necessity. And I do think you're going to see some people hanging back, especially on some of the routine services as well, because they'll just say, I'm just not going to bother for right now. I have competing priorities. Now, they'll take care of their kids first, so be sure of that. But from an adult population, I think employers have some things to worry about.
You know, it's funny, when you think about, can we project out like what the cost will be to us as an employee, as a family, as a citizen, if you will. You know, I know each year during annual selection of benefits, you know, I've often tried to figure out like, okay, what am I expecting for my medical costs in the next year? But often there's an unexpected medical expense or even a surprise event. So say a little bit about your experience of how you see this arising and the impact of these events.
Yeah, a lot of employees, to your point, you can take a look at what you spent last year, and we know that's what the actuaries look at, but that doesn't necessarily mean that's what you're going to spend this year, right? You don't, your kid's climbing a tree, falls out of the tree, broken arm, right? You know, you fall, sprained ankle or whatever. So you really can't plan for that. And I also think that because so many people are feeling the pinch financially, they may not be putting as much money away in their health savings account or their flexible spending account. So I think as employers, we really need to figure out how to get creative. Many employers, as an example, they started contributing to the health savings accounts and then they pulled back over time. Well, maybe you got to give people a little bit of wiggle room during this time, this next year or two of financial stress, and say, you know what, I'm gonna match you in your health savings account for the next year or two to help incentivize people to put money away so that they can feel like they can actually go and access the system when they need it, David.
Yeah, it's a great example. I still remember my brother when we were growing up, he fell out of a tree and we had some healthcare expenses. That was a great example. Brought back some memories. But yeah, you never know what's around the corner from a medical expense. And what's amazing here is that so many people are starting to have, you know, unpaid debt from their medical expenses. Let's, you know, we have an audience of a lot of folks from the employer community, benefit managers, CHROs, et cetera, on the call. Let's check in with them, Beth, and see, like, question for the audience. And you will get a poll right now. Please go on the poll and answer the question here. The question is, how are you currently addressing your high employee healthcare costs? And if you're not an employer per se, you can answer the way your employer is dealing with this. Are you increasing the use of high-performing networks, meaning narrowing the network that can be utilized or providing incentives for your employers to use certain providers that are high-performing? Are you focusing your strategy on those employees who have high claims, who are high-cost patients, if you will, high-cost employees from a healthcare perspective? Are you implementing more advanced primary care strategies? And that might mean putting, you know, clinics in on-site or near-site. There's a lot of vendors doing that now today. And then also, you know, virtual care solutions have suddenly come out of the woodwork, even though we've talked about it for a long time. Telehealth, remote care. I've actually gotten a little bit of physical therapy, and all my physical therapy visits are virtual with my laptop here at home, which actually is quite convenient for me. So let's check in with the audience. Beth, does this capture the whole world, the whole universe of the types of ways that employers can manage their healthcare costs, or are there others?
There's some tried and true things that employers have been doing for a while around wellness, mandating health assessments so that people can really get their arms around, you know, their own behaviors. I think the increased cost sharing. But I think what this really points out, David, is that particularly with self-funded employers and some full-insured employers, they're really trying to cobble together anything they can get their hands on that will give them an improved claims cost and a good outcomes. for their employees. So I think this trend of trying these different services, David, I think is going to continue for the foreseeable future, because employers are just saying, give me something where I can walk into my CFO and say, good news, in 2021, we're going to be flat with our healthcare costs over 2020. And that would be a big, win for a company if they could say that in a normal year in particular.
Yeah, I have to tell you that one of our customers here at Innovacer, one of the country's largest 25 employers, I was pretty floored when we sat and talked to their benefit team, and they were so proud of the fact that they got their costs at inflation rate. Like, it's 25 years trying to get there, and they got there for 1 year, and we'll see where that goes. But
and David, what I was going to say is what employers are going to be really nervous about is 2022, because people have held back, and so they may be seeing, if they're fully insured in particular, they may be seeing their premiums being held this year by the insurance companies. But what happens when people do start utilizing again? Are they going to go up 8% or 10% in 2022 or 2023? So they're a little worried that maybe there's a light at the end of the tunnel and it is a train.
That's right, or 20%, who knows? I mean, with all these elective surgeries being postponed, with the impact of COVID, we don't know if the vaccine will work, what will be the expense of all these things coming together. It could be a train. It could be that light at the end of the train, absolutely. Well, it looks like most people have answered the poll. Let's go ahead and see where our audience was at with their strategies. We can pull the poll results up. Oh, very interesting. 59% virtual care. Wow. Beth, what do you make of these results?
Yeah, not surprising. On the virtual care front, David, a lot of employers have taken upon themselves to contract directly with many of the telehealth platforms and give this service away free to their employees or for very, very low costs. And like I said, a lot of them with the high deductible health plans have basically taken it totally out of the medical benefits so that they can access it. This idea of narrow networks, what I'm seeing a lot of is employers sort of overlaying one network on top of their existing network. So maybe they contract with one of the big health insurance carriers, but then they actually contract with a company that will specialize in getting the best hospitals and physicians for maybe it's a heart surgery, and not just transplants, but more typical surgeries, knees and joint replacements and things like that. And then they overlay it. And then what they do is they offer a really attractive incentive for employees to be able to go to these facilities. They'll pay the transportation costs. Oftentimes they'll pay it at 100%. So the use of these different networks, I think you're going to continue to see more and more and more. And of course, we've seen on the high claimants, David, right? Companies like Accolade or Castlight, people saying, look, I'm going to pay somebody to help my employees not just navigate, but also make sure they're actively using their benefit, because that's the other concern. Sometimes they feel like employees aren't using their benefits, and things like dental insurance, they're not going for their cleanings. And David, you're a doctor. If you're not going for your cleanings, I mean, that could, increase your risk of stroke as an example. So really, really important stuff.
No, that's a great example. I'm going to actually use the entree you gave me. Oral health is a huge driver of overall healthcare costs, and a lot of people don't realize that. They think it just has to do with their mouth. Yeah, absolutely. That's a great example. What I find fascinating here, Beth, and again, I've been in the industry as long as you have, and we've had different perspectives on what we've done. There was a strong emphasis 15, 20 years ago around managing high cost claims, those with congestive heart failure, the disease management trend. And then after that was a focus on primary care strategies. I'm surprised to see those numbers so much lower. I get the virtual care given COVID, and interested to see the high performing networks. Why do you think the less focus on primary care strategies?
Well, I think some of it might be, David, that there has been focus on that in the past, and so some of these programs are in place. So I think maybe what some of our audience participants are conveying to us is that the use of virtual care solutions and the use of these networks are a little bit newer than what some of the other strategies are, with the exception of direct primary care, which is, as you know, David, is just still sort of up and coming.
Yeah, yeah. No, this has been a very interesting poll indeed. Really pulls together where people are at today. So very helpful for that. Well, let's kind of go back and just level set before we get into some potential solution sets here. And I want to ask a question before we get into this idea of employee engagement. Let's go back to why employers purchase healthcare and how they would think about their employees, that low net promoter score, et cetera. How does that relate to the workplace?
Well, as we talked about earlier, it is table stakes, right? You have to really be able to attract the right talent. You have to have coverage for health benefits. But more importantly, what you want, David, is every day you want people bringing their A game to work. And you can't bring your A game to work unless physically, physically you feel like you can give it your all. You're not exhausted after 3 hours. And emotionally, you're there as well. And, that's what employees are really looking for. When I think of engagement, I think I'm bringing my A game to work. I'm engaged physically, I'm engaged emotionally, meaning I have the energy and I have the focus that I need. And then also, I like the mission of the company and I feel like I have a sense of community. It's those things wrapped together that people that people want for engagement. So that health piece of it, emotional as well as physical, is just absolutely critical, because if you're feeling overwhelmed because you have multiple conditions or you're depressed, you're not going to be able to bring your A game to work and you're not going to be engaged. And then that impacts productivity and morale in the workplace. And it goes on and on, really has a ripple effect.
This is a great slide that starts to break out what I think is a more complicated concept of employee engagement. I think that's a relatively new concept, right?
It is. Most employers in the past have really looked at, am I at the workplace, right? How many days off am I taking? But engagement really is about, am I really engaged in the work? Am I really as productive as I can be? And there are studies out there, David, that show that the higher the level of engagement that somebody has, the more productive they are for you. If it's a salesperson, if they're tired, they're usually typically more productive if they're engaged and they believe the mission and they're physically and emotionally well. They're gonna knock the ball out of the park as opposed to somebody who isn't engaged.
No, great comments. I think it goes back to table stakes. You want people to be satisfied, but that's just to make sure that, they can't be engaged unless they're satisfied. They'll leave the workplace if they're not satisfied. And then right. Happiness, it's funny. I work here in Silicon Valley. I see a lot of these early stage companies putting ping pong tables and, they have people playing games. And I get that because they want to keep their developers working long hours. But happiness is not the same as being engaged, is it?
No, I would say that, engagement is I would say is this feeling of energy that you get when you are working with your colleagues. And have you ever worked with somebody that just really brings a lot of energy to the table, and it just feels like the group is more productive, and you get more accomplished, you get alignment faster? That's typically what employers are really looking for, and that's a feeling that people enjoy, because they sit there and say, I like going to work because I get energized when I'm at work.
No, that's awesome. And, it kind of relates to some of the history we've all learned around management techniques, right? It's really about getting people to feel empowered, and therefore they start to feel passionate and really enjoy what they do, as opposed to feeling controlled or not happy with what they're doing. And these are all key things around this concept of engagement. So have people in the employer community, have CHROs and benefit managers, have they been universally embracing this concept of employee engagement, or what's the current status?
I'd say that most HR departments have gotten it earlier than some other members of senior leadership. There are clearly examples of companies that have really understood this, and there are third parties out there that administer employee engagement surveys, and so you can start to measure year over year. So it is really making its way, if you will, around the executive table. I think there's still some detractors there because it feels a little intangible sometimes. But if you take the time to measure it and you take the time to collect the data, then you can actually start to demonstrate to your peers around the table how effective that this really is. So I do think that the belief is rapidly increasing. And I think now, David, as a result of COVID, I think now you actually have everybody at the leadership table going, oh my gosh, how are we going to keep our employees engaged, right? Because now they're working from home. Many of them.
That makes a lot of sense. And with COVID and so much people doing Zoom and other types of virtual work, it can be a little bit exhausting and can impact employee engagement, I would imagine.
Oh, for sure. I mean, when we think about Zoom calls, before you'd have an opportunity maybe to walk from one meeting to another. So you had an opportunity to get a little bit of physical exercise. We're now on Zoom calls all day, David, and we don't, we're not moving, right? And so we don't get a physical break because it's just meeting. We don't even walk from here to there. And then the emotional break as well. It's really tough to get an emotional break. Things are just, and things are escalated because of the pandemic, and our workloads have often increased. So it's this remote work environment. Some people say I love it, but it's really taken its toll off on the workforce.
So it's interesting looking at this data from this Carnegie Research Institute results. There's a significant number of people who think it's a priority, but they may not get around to it. They're not sure. Very few people don't think about it, but there's not a big, robust, folks that are really leveraging it in a big way. One of the questions I'm wondering is that because we don't know how to measure it?
I think that's exactly it. People don't understand what kind of data do I need to collect, number one, to understand what employee engagement is. And even if you have a third party that's administering the questions, okay, so what? What do you do with it? Because you really need to be able to understand what that impact is and tie it back to claims expense or time off and other things like that. So I think being able to collect the data and then figuring out what do you do with it? How do I manage all this data?
So, there's a couple different buckets here. This gets to be a little complicated, it looks like. So let's kind of walk through some of these. We talked earlier about that low NPS score that employers experience with their employees around the offering of their benefits, 9 versus Amazon, much, much higher. Have you seen many employers starting to measure employee NPS as it relates to their benefits?
Yeah, I am starting to see that with employers of all sizes. Interestingly enough, though, as you point out, some of the smaller employers, the startups, are doing a really good job of measuring NPS because they really understand, they get it intuitively, that employee engagement really, really matters.
And you mentioned the traditional measures, which would be like measures of turnover or absentee, because they're fairly easy to measure, not necessarily related directly to health benefits. That's a tough call in terms of it, but it's important, isn't it?
Absolutely, because in most companies, it costs a lot of money to hire a new employee and train them. And if they're, leaving within 90 days or even 6 months later, that's money out the window, right? And not to mention that your customer experience is probably really going to be poor. And there's one more thing that I would add that isn't on here that I was thinking about, David, and it's a measure called customer effort. And oftentimes we think of it truly for our customers, how easy is it for them to do business with us? Well, this is something that employers are really starting to learn and look at employee effort. How difficult is it for them to do their jobs? Because if you have a customer service representative, for example, and they're navigating among 3 or 4 systems just to be able to answer a question for a customer, that takes its toll on that individual, and you're going to really have a difficult time getting high employee engagement and keeping or retaining that employees.
Now, it's a great example. It's one of the downsides of, technology. I had to call government. I just moved to California this year and still delays in getting my driver's license. I was on call for like an hour waiting for somebody, and then they said, well, I can press 1 and maybe get somebody to call me. 5 hours later, somebody called me. So, it's very frustrating. And then, certainly one of the things we've done, we'll get into a little bit about our role in data, we've had health systems where they say we have this contact center, right? Because it's not just calls anymore, it's emails and social media. Contact center, they said we have all these different channels and our reps are so busy doing all this, can we bring all this together? So I think the experience of a customer, the experience of tying this stuff together can really help here. Let's go to this bottom left one though. I know I've worked with employers for, again, going back 30 years, and this idea of how do you measure productivity or production or the impact on benefits to profitability of the company. Have we seen any advances in measuring that?
We have. A lot of the companies that will work with a third party in particular, or maybe have their own proprietary employee engagement survey, will in fact take a look at specific questions in that survey, and then they'll tie it back to groups of employees, maybe sales as an example. And they will look on a de-identified basis at the productivity of a salesperson that is engaged or isn't engaged. Like one of the most prevalent questions is, do you have a best friend at work? Because people like to have a sense of community. So they'll start to tie performance on a de-identified basis, because they always want people to feel really comfortable about answering those questions honestly. And they'll start to see, and I've seen studies where, again, the salespeople that had higher engagement, their performance was absolutely through the roof. And what's important about that, David, is now, if I'm sitting there in human resources, I have some real hard data to start to take back to my CFO now to say, look, this is why we need additional funding when we think about budget time to invest in our employees.
This is a really interesting view into the complexity of the measures that can be used, but it actually gives us great hope that this concept of employee engagement will be very helpful going forward, as it has been today. And I think this, if we look at this recent survey this year by Deloitte, we see that employee engagement seems to be important for a variety of reasons, doesn't it?
Yeah, it really, really is. I mean, I mentioned before, the productivity is important, the ability to retain employees, because every time there's a turnover, it's a pretty significant cost, and not just a physical cost in terms of dollars out the door, but think about a long-standing employee that may leave in the history, the rich history and experience that goes with that employee. So, and most employers now, they want to be a place where employees want to work, especially as we think about digital transformations, David, right? And those types of strategies that companies are undertaking, they want to get the top employees to really be able to come on board. And so there's really fierce competition for many types of skill sets out there. So you better be good at employee engagement if you're gonna grow your business and move it forward.
I really liked your comments before about these early stage companies, tech companies, et cetera, using these interesting tools. We're a very rapidly growing company, as having been involved with us as an advisor. I think when I joined just a few years ago, we were under 100 people, and now we're 600 plus. So but we do this employee engagement. We get these check-in, these little pop-ups that while we're working, 1 or 2 simple questions, and it's always mixed up, targeted. There's a lot of AI behind it. And it really helps us prevent this bottom left here of actively disengaged, because we do not want employees that are disengaged. So again, this is great data, a lot of room for improvements here. This is fabulous stuff. We've had this impact of COVID. I know you're involved with the American Telehealth Association, and you've had this perspective ahead of time, before COVID, about how we can start to engage people with healthcare virtually. What are some of the other challenges you're seeing people with trying to deal with a remote workforce?
Yeah, I think one of the biggest challenges is that people think that with COVID, people are now working remotely. Well, we didn't just take what was happening at the office and pick it up and put it in the home. We actually put it in the middle of a hub that is now a daycare, it's a school, it may be a senior daycare because your parents have moved in with you. And what employers are starting to see is that employees are struggling. They're really struggling with how to keep up. I was reading something recently where employers were saying it's difficult to get employees on Zoom calls and get everybody together at the same time, even during the middle of the day, because people now have these additional responsibilities, right? They're a teacher, they're a social worker, they're a daycare worker, they're a cook. And the only thing that's been taken off their plate has been chauffeur, right? So one of the things that employers have to start to look for is what are these additional burdens that people are taking on at home that they didn't have before, and what can they do to help? Instead of just saying, hey, wait a minute, I better make sure that my employees are at this meeting at this time. Start to look at the data that you have, and if you see people are sitting idle on their systems for hours at a time, don't just sit there and say, hey, they're slacking off. It's probably a sign that something's going on with your community, with your employee population, and you need to rethink the types of strategies you need to put in place to help them through this time, because this is really different. Nobody's faced this before. I mean, imagine if I use a parallel, taking your 3 kids, holding on to them all day, bringing them into the office, right? Trying to feed them while you're in a conference room on a meeting, right? That's what's happening in the home, David, right?
Yeah, and plus everybody's competing for bandwidth, right, to do their homework assignments or whatever. The one benefit I have to admit to all of this is I've gotten to really know my employees' families and children. So it actually has been a bit of a positive piece, but I can't imagine what it's like. I fortunately am not in that situation to balance all those things. But I do love the story I often hear is, oh, I'm sorry, my son's complaining because I'm using up bandwidth.
Right. Yeah, the video game's gonna have to wait, right?
That's right. So let's check in with our audience one last time and just ask them what they're doing to improve employee engagement. I think this will be helpful for everybody to see. So if you can go to the poll and just answer the question, what are you doing today? Are you trying to, employ your outreach, improve your outreach to drive benefits adoption? Are you enabling more virtual care options for your employees? Are you improving benefit navigation through adopting a technology like what we offer here in Innovator? Are you trying to get better navigation through concierge services some other folks offer? So if you could take that poll, but I think one of the issues you brought up is we relate engagement and then healthcare and benefits, huge percentage of cost, right? 20% plus. And then the out-of-pocket debt for employees, all this stuff comes together, right? When we're talking virtual care at home, keeping people engaged in the workforce, trying to figure out how to do that in this new world. Beth, how do you think about this issue as an employee when I'm offered all these benefits? How do I pull it all together? How do I make sense of it? How do I navigate it? What do you think are the tools for an employee to do that?
It's really, really hard for an employee to figure out how to navigate, because most of their information about these benefits, it sits in different systems. And even if it's been tried to be pulled together, it's usually open this PDF, so on and so forth. And I think what would really help, especially because many people are working remotely, but even when they do start to come back into the office, how do you have a place where they can not only have this information together, but I, as an employee, can actually get some insights into what might help me. So as an example, if I have a visit to the physician and I have maybe I go to the emergency room because I've sprained my ankle or something, wouldn't it be neat if somebody reminded me that I also have a supplemental benefit, right? A supplemental policy that I could actually submit that claim and get $100 or $200 reimbursement for that and help me with my deductible. Wouldn't it be great if somebody reminded me in my busy schedule to go and get my my dental exam or my eye exam? So I think that, having this information be pushed, because most people don't have time to dig around, right? I always say, if you want me to see something, push it to me. And I know people push a lot of stuff, but I'm more apt to read it if you push it to me than if I have to dig around and try to find it.
That makes sense. Well, let's check in with our audience and see what the poll results show. We can pull results up. Looks like they're just getting done just now. Here we go. Wow. We were talking about navigation. Beth, what do you think of this?
Yeah, so it sounds like that's spot on, that people really understand that navigation technology is really needed, because you want it integrated into the systems that your employees are using every day, right, David, to make it as easy as possible.
Yeah, it's amazing. So when we talk about navigation, there's two aspects here, right? There's the benefit manager and the employer who needs to sort of navigate the choice of the benefits they're offering, what's working, what's not working. trying to make sure people, are steered toward, those things. And then what is the impact on engagement, right? You can try to navigate that. That seems to me it would be wonderful to pull all that data together and create a dashboard. And then there's the employee who needs to navigate all these benefits. I have to say, and we actually have a great navigation plan here at Innovacer. I had an engineer often send me, he just like 2 weeks ago, sent me a little summary of where I can access a better benefit on a waiver rider that's on my XYZ policy around my vision benefit, which is better than our vision carrier, and attached the forms and gave a workflow for how to do that. Like, we're helping each other, but it's a complicated landscape.
Right.
For sure. So let's get into this. And obviously technology is playing a role here, and technology may help. Do people want to see data, just data, or do they need something more?
They want to see something that's personalized to them. So they don't want to have to take the time to figure out all the different machinations of designs that are offered, or say, okay, wait a minute, is there that rider there? Just like that person teed that up to you. So they want really it to be personalized, number one. Number two, many people actually do want to self-serve, right? And so when you think about why it was so popular on that in the poll response, David, for people with technology navigation, because people want to say, let me try to do it myself, because I know that's fastest, right? And then you save the call to a human for something that's really, really complex. But I think this idea of saying it's personalized and it's based upon what you're experiencing, a claim that you've submitted, or maybe it's time for your mammogram or whatever, that's what they really want. They don't, we can start to do away with some of these generic letters that come out in the mail, right? They say, oh, go get your physical exam. Well, great, it came out 2 weeks after I got mine, you just haven't paid the claim yet.
Well, you're talking about all these different benefits that would be offered to you and how they're hard to navigate. But then as an employer who's purchasing these, right, this high rising cost, this burning platform, this impending crisis down the road, given COVID and all the things we talked about, you need to have some form of insight into your employee population. And in your experience, do people have great insight into the risk of their employee population, what's working, what's not working, what will happen?
No, they don't. What happens, David, is they look in silos. And even if you took healthcare benefits and took the medical plan, even within there, they're looking at a bunch of silos. So they'll be looking at musculoskeletal here, or diabetes here, or CHF over here. And what they really need to be able to do is step back and get a holistic view of a particular individual, so that they can start to push the information or create a custom plan, if you will, meaning care plan to really help that individual. So if you have diabetes and CHF and you're having low back pain, well, today you're probably going to get 3 separate emails about 3 separate programs. What you need is somebody to sit there and say, well, wait a minute, Beth has all 3 of these. So how do we create a personalized plan for her and let her decide what she wants to work on first and move that together? But when you have data in disparate systems and you're not getting a holistic view of the individual, people, honestly, they just tune out.
And it's funny with the analytics advances we've made, and we've read about this and we've experienced in other industries, and certainly we've been building this here at Innovacer, is how do you apply the analytics as to being able to predict what will happen and provide people insights as to what to do next, both the employer around their benefit selections and navigating their choices around offering new benefits or getting rid of some, and also for the employer about what to offer. Bring up this complete and holistic view. Say a little bit more about how you would approach that from a data perspective.
Well, I think that the big struggle that employers have is how do you get it onto a single platform or in a single structure that then you can actually call that data and apply analytics to it to determine what's going on. So that's the biggest challenge that employers have, particularly in human resources, because a lot of time these systems they have, David, have been tremendously underfunded. They have not. The R&D department may have advanced analytics, but that doesn't necessarily exist in the HR department.
No, it's a great point. And, it's so funny because other departments may have a command center or dashboard like we're looking at here. interesting example of showing real-time examples of, say, a back pain program, like how many of my employees are accessing care. I don't see the private information. I'm not privy to that. I don't need to. But as a population, how many are receiving back pain services, have this? And then, the benefits I'm offering, what kind of savings am I getting from it? By the way, back pain seems to be a big rising cost given COVID and all the people working at home. But again, a command center to really see, what is your employee satisfaction with the programs? What is the retention rate? All these things we talked about measuring earlier and how complicated that is, having it in one place. That would be a nice view, wouldn't it?
It sure would. And then what you can do as a leader, once you start to see it, I'll give you a personal example. When we started to understand that at one of my employers, that our employees were really feeling super stressed, we introduced initially a half hour as an experiment, then we went to an hour well-being time a week. And we're able to, through the pilot, determine a return on investment there. But had we not had that information not been brought to me as a business leader who had to be able to authorize that change, that couldn't just come from HR without a discussion because of productivity and things like that. So I think that, you can really start to form a partnership between human resources and your business if you are able to share this data with them and the insights, and then have them set forth an action plan to carry out on. Because as leaders, we want our employees to be healthy, happy, and engaged.
Absolutely. And it's funny, we also talked about from an employee perspective about making sure that we keep people engaged. And I always think about the fact that we all have one of these. Mine's right here. And they're such great tools. But have you seen employers use this as a way to help the employee navigate their benefits and their management program?
Yeah, once an employer can really start to understand where there are gaps, and when I say gaps, maybe it's a certain service that isn't being used, then they can start to actually push that information out to the employees that really need to receive it. And they can do that in a broad way. They can do that in a way that sort of masks what somebody's getting. But yes, they can start to push that information. As I said earlier, people aren't going to go digging unless there's an absolute dire need for it. So if you want to keep these things top of mind, you want to keep your employees engaged, you've got to figure out how to push to them in an appropriate way.
Yeah, I like what you said about PDS. For years, insurers have struggled with keeping their network data accurate and timely and useful for the employee to navigate. I still remember going through PDFs of network lists, trying to find, maybe how close they are to me, and I don't know how good they are or what's my experience. This just seems to be a nice way to help people navigate using their phone.
Right, absolutely, and you're absolutely right. Everybody has a phone. It is their hub of their life, and so you go to where your employees are.
I know sometimes I talk about, what we're doing here at Innovator as being kind of like what Amazon tried to do. People thought they were a bookstore. You go pick a book and you can see its inventory is shipped to you huge advance. But it was really about learning about the person, meaning once you had all of these different retailers and suppliers on the platform and all these different consumers, we all know that when we go on Amazon to buy things, it knows you and it learns about you, as does Google and Netflix, and tease up things that you need to know. Or in this case, you have particular medical issues or wellness issues, the benefits offered can be pushed to you and teed up in a personalized way. That seems to be missing in healthcare, at least to date, I think.
Right, and in fact, in many types of healthcare in the past, it was oh, if you don't use, that's better for the insurance company. Well, luckily they've all flipped their model to say, no, we know we need to get people in to use their care. Even the dental programs paying at 100% and encouraging people to go in. So you're absolutely right, but it's got to be personalized. It's got to be something that's meaningful to me. Most people say, David, when they get something in the mail for their insurance company, they actually toss it in the trash without even opening it. What does that tell you? They know that it's not going to be personalized to them.
That's right. Absolutely. So I think this is a huge advance. Let me just give a little commentary here about kind of what we're trying to accomplish in Innovator, and then the last 5 minutes I want to open up for questions. We have a few questions coming in but please just go right into the chat box and go ahead and enter a question, and we'll tee it up here in 1 second. But Beth, you've been working with us as an advisor, and we're a data company. That's our heart, and it's really about how do you bring in data, which we've done in healthcare now for many years. But how do you bring in data from all these sources on the benefits side, right? The HRA data, the biometric data, the financial data CFOs are very interested, obviously, in the cost of all these benefits, health benefits, wellness benefits, and then make that holistic view, give that kind of command center that we showed, the dashboards, and engage the employee through that phone in a personalized way, push things to them, and really be able to navigate how I'm offering the benefits. Are my employees engaged? Am I having the impact with the benefits? And how do I change that? And can I watch the response of engagement, productivity, all those things we talked about? Seems to be that would be the holy grail of what we've been trying to achieve for many.
Yeah, absolutely. David, there's a lot of different data and a lot of different pockets in not only inside the organization, but all of the business partners that a company works with. And a lot of it is just sitting there unused. Think about a health risk assessment and how much information we collect in there about alcohol, tobacco use, about social isolation. And yet we're not doing anything with that. And so imagine if you can bring it together in a platform, have that teed up, and then be able to provide actionable insights at the individual level, and even at the leadership level. You can really start to change the game for an employer and change their culture and change the level of employee engagement.
Wow, that would be awesome. And that would really just bring us to a different place, and hopefully maybe even help bring down these healthcare costs.
Exactly.
Let me open this up. I've got a number of questions for you in here. First question for you, Beth, is an interesting and provocative question. Isn't employee health costs a catalyst for a universal healthcare system?
Well, I think that employee healthcare costs it's certainly an industry that is ripe. Healthcare is certainly an industry that's ripe for disruption. I don't know that that necessarily needs universal healthcare coverage. I do think it's something that you certainly want as many people to have coverage as possible. So everybody wants to make sure that people are taken care of, but universal coverage doesn't necessarily mean the costs are going to go down. You have to look at the whole system and all of these stakeholders in the system and the way the systems work, and some of those things that we had on the slide up front. So I wouldn't necessarily equate high cost to universal coverage being the solution. I think broad coverage is definitely something we want to achieve, but you have to tackle some of the underlying issues first.
Yeah, here's another question. That's a great response. Hang on a second, my chat box was not quite working great. There's a lot of questions. Okay, here. We have been working from home for a few years now. Oh, so this is someone who's been doing this for a while. And COVID introduced a series of new issues to the world, but helped us as an organization. Now companies have to focus on individual employee, not the entire workforce. In the absence of corporate offices, individual workstation setup is now needed. Any thoughts about that? Because the former procurement methods are not as relevant anymore.
Right, and very good insight, because in the past, the focus still was on the physical space, even though you had remote workers. And now what you have to start to think about is, okay, the new office is now everywhere. So what are the needs my employees have in their new office, and how's that going to vary by the role that they have? And then my needs as a leader, what am I going to do for my leaders? How am I going to make sure that my leaders can ensure productivity of their workers without micromanaging or doing anything that's draconian? So they're really going to have to think about it from the fact that no office is going to be like, so usually you could go down and say cubicle. Well, now that's not happening because we're all in our own little offices. And then how do you help leaders understand how to lead in this new environment? So great insight. Great questions, David.
Great. Yeah, so there's a lot of other great questions here, but we are at time. But Beth, I want to thank you very much for joining us today, and thank you all for your audience participating. Beth, these have been some great insights. Thank you so much for sharing them with us.
Oh, my pleasure.
And many thanks to the audience for coming. We would love to learn more about you. Please attend our future residents, future webinars in the future. We do this at least once a month, and we've been having a greater focus in our employer offerings around tying data together to really help you build dashboards, engage your employees, and help to hopefully lower your healthcare costs and get the kind of results you want. Thank you so much for attending, and we'll be in touch. And thanks once again. Bye-bye. This concludes our webinar.
So we're good?